Dr. George. Welcome to LA FUE Hair Clinic. This is Jesse. He's in the hot seat today. How you feeling?
Nervous, but very excited.
Beautiful. So the plan for Jesse today, what we're gonna do is restructure the hairline. It is a naturally high hairline. What we're gonna do, take this, lower it just a bit, connect it to the temples, fill in all these open areas right here, so we can straighten it out, make it a little bit more of an age-appropriate hairline. Now, Jesse, why'd you choose us?
You're the best I could find. And I've been following you guys on Instagram for about 5 years, and I'm happy I'm actually getting it done, and I'm in here, and these guys have been absolutely perfect, excellent, top-notch professionalism, and I'm really excited to get started.
What we're gonna do now for you, take a look at the donor, see what the areas are that we're gonna go into. Once we take a look at that, we're gonna shave everything, disinfect it, give you a few injections, okay?
Cool.
What I'm gonna do with this marker now is just highlight areas that I don't wanna go into. Areas where I see where your whorl is, I don't wanna touch that. Areas down here that the hair's not as thick for really everyone. I don't wanna take too much from those areas, so I'm gonna highlight those areas for you now, okay? As we can see, areas right by the ear, kind of at the base of the head, those hairs aren't as thick. They're not as full as areas up here. So we don't want to use those hairs because how it looks here is how it's going to look here. Or how it looks here is how it's going to look here. So we always want to use the highest quality hairs when doing hair restoration to make sure that we get the best possible outcome down the line. Ready to get started?
Yes, sir.
Here we go.
I apologize, you got to work around my lumpy head.
Oh, I'm used to it. Yeah. Your head's more uniform than you give it credit for.
Oh, good. Thank you.
All I'm doing now for you, Jesse, is creating the grid in just a moment for your donor.
Okay.
So I know exactly how much I'm going to take from back here so we don't lose track at any point. Everything is disinfected now. What I'm going to do is start with the injections. So 4 phases to the day, really only 2 points where the discomfort is a little bit more apparent. Yep. This is one of them.
Yep.
Injections for the donor area now, and then later on injections in the eyebrow and the recipient areas. Okay? It's going to be uncomfortable, but it's going to be quick. They are numbing injections, so even though it sucks for a second, very shortly thereafter, everything will start going numb. You won't really feel it too much. Give it a couple of minutes, okay?
Well, let's do it.
Little vibration device to help distract you a bit. I'm going to get started.
Okay.
1, 2. This area right by the ear and the base of the head where it meets the top of the neck, generally the most uncomfortable. Oh, yeah. There you go. That's 1 series. Now we're going to do the top, okay? 1, 2. Deep breaths in and out. Perfect. Coming back across to the front. Beautiful. Right side's all done.
Hey, I'm trying my best not to wince over here, okay?
You're doing great. I didn't feel a thing.
You're good.
1, 2. Remember, it's going to be a 8-10 hour day. Total maybe 5 minutes of pain.
Yeah. That's what I've been telling myself for years.
All right. Now the top.
Okay.
2. Perfect. Injections are all done.
You know what? That didn't hurt at all.
Feeling all right, Jesse?
Well, all right.
Did that medication kick in? Are you feeling a bit more relaxed now?
Pretty relaxed.
Feel free to take a little nap, okay? everything's going about as smoothly as possible up here for you. You're doing great. Below average bleeding, your grafts are coming out very smoothly. Lots of multiples so far. You're doing great, okay? All right, Jesse, you made it through the hardest phase of the day, the harvesting phase, the first phase. How was it for you?
It was good. It was long, and but it was nothing that the average person can't get through.
So not too much discomfort besides the pokes, things of that nature.
Correct.
Perfect. Okay, so let's go through your numbers for you. This is the first time you're seeing it, so
Yes.
we got 3,219 grafts for you.
Sweet.
Now, we spoke about it while we were working earlier. The average distribution of numbers for the grafts are the following. Typically, on average, you see around 25% singles. Singles meaning one hair for that follicular unit. Typically, you see around 50% doubles, meaning 2 hairs per follicular unit, and then finally another 25% or so for the triples, and we kind of lump in the 3s, the 4s, the 5s in one unit, and we just call them all triples. So the bigger that number is for the triples, the more dense your hair is, the stronger the final outcome.
Mm-hmm.
So knowing those numbers, let's go through what yours were.
Good.
Only 15% singles, so 10% below average. Very good thing.
Good.
Doubles, 35%, 15% below average,
Mm-hmm.
which means the total of 25% below average you had for singles and doubles combined are all here for the triples.
Awesome.
Which is the best case scenario. We want the triples to be more than the doubles, to be more than the singles. And if this is bigger or equal to both of these combined, that's the best case scenario.
So
So
what
you
you're
have-
telling me, I got good hair.
Great hair.
All right.
Great hair. That being said, we're going to jump into the design phase.
Alrighty.
What we're going to do now is take a few measurements of the face just to see what your individual proportions are. And once we do that, we'll then start with different designs, show you something different on the left, different on the right, and take it from there, okay?
Yeah.
So I'm going to hand you this mirror so you can see exactly what it is that I'm doing. The proportions I use are chin to nose, nose to eyebrow, eyebrow to hairline. So I want this distance from chin to nose to be the same as nose to eyebrow, to be the same as eyebrow to hairline.
Good.
Now that's not a hard set fast rule, but it is something that we use as a general guideline. So that being said, let's take a look.
Why you gotta do me like this on camera, man? With the
I'm
hair,
so
with
sorry.
the hair. Come on,
I'm
man.
sorry. It's going to be worth it in the end, I
I
promise.
know.
Chin
Mm-hmm.
to eyebrow. You see it's about 14.5 centimeters. You see that?
Mm-hmm.
So that makes this 7.25 plus or minus.
All right.
So from more or less that same point, you want it to be at around 7.25, which is right there for you.
Okay.
You see that?
Mm-hmm.
So I'm going to put a little mark there.
Sure.
That'll be our guideline.
Sure.
It was right here. So I'm going to use that, go up a little bit, down a little bit, try a few different things, okay?
Sure.
Now what I also want to do, come around,
Yeah, please.
but I do want you to see your lateral proportions as well.
Mm-hmm.
So lateral proportions being the midline of your face to where your temple is. Average is about 8. So if this is 9 or 10, for example, that's just more grafts that we need. And if it's 7 or 6, for example, that's less grafts.
Mm-hmm.
So middle to the bulk of this temple here is about 8.5 centimeters. You see that?
Mm-hmm.
On your right side.
Mm-hmm.
So a little bit above average. Which makes sense, you're a tall guy. And one more time here now. On the left, it's about 8 centimeters. You see that?
Mm-hmm.
So what that tells me is you have a little bit more loss on this side compared to this side.
Yeah, I've noticed that.
And even if it's not lost and that's just your natural hairline, no one's hairline is perfectly symmetrical left to right, ever. No one's face is ever perfectly symmetrical. So my goal now is to help balance that out to some extent to minimize what the size of the forehead looks like, okay?
Mm-hmm.
Now raise the eyebrows for me as high as they go and relax. Beautiful. When I ask you to do that, what I'm looking for is where the forehead musculature stops. That's going to guide me towards where the safest area is going to be. going to.
Now, I would like to make a request.
Mm-hmm.
Don't make me look too good.
No promises.
You gotta save some women for the rest of you.
No promises.
Okay, you can cut that out of the video.
I prefer you didn't.
Yeah.
Now I do have a preference between these two already,
Mm-hmm.
so I'm just gonna clean this line up a little bit, show you,
Mm-hmm.
and then we're gonna tweak both sides again, okay?
Sure.
I don't want to say anything yet.
Okay.
So you look at it, you kind of tell me what you see, what you think.
I can't tell much of a difference.
Okay.
Between the two.
So let's go through it.
What's the difference?
This one, as you can see, is a little bit higher right here in the middle. This one's maybe 2 millimeters lower
Gotcha.
here on your left side.
Mhm.
This side's a little straighter,
Mm-hmm.
whereas this side has a little bit more of that curve maturity to it.
Okay.
And even though the endpoints are more or less the same, because this is just a touch lower, it has that mature look.
Mm-hmm.
Now, I like that. I like that mature look.
Mm-hmm.
I do want
So you like them more curled up a little bit?
a little bit. And again, more or less the same location, not the angle or the structure, but
Mhm.
more or less the same location where the hairline ends. But because this is just a touch lower,
Mm-hmm.
has a little bit more of that maturity. And I think that look suits you
Okay.
because that's the structure of your head.
Yeah.
Right? If you had a wider face, a straighter hairline would make more sense. If you have a longer head, the longer hairline with a little bit more maturity makes more sense. My goal is to supplement what your current hairline is, which is this, straighten it out to some extent, not
Mhm.
too straight, that won't be face appropriate,
Mm-hmm.
and cover all of these open areas that you're seeing here.
Mm-hmm.
Between the two, do you have a preference so far? And then I'll give you my input.
I see what you mean. I kind of like the up,
Mhm.
angle, but when I'm looking at this one, I like the size better.
Yeah.
You know what I mean?
Yeah.
Um.
So the reason why I wanted to show you two different designs
Mm-hmm.
is because I want you to see the differences in the structure.
Yeah.
And what that showed me, what you just said, was
Yeah.
you
I think I like this one. Then.
yeah, you like aspects of both.
Yeah.
So now what I want to do is combine the two.
Okay.
You like the minimization of the forehead on this side,
Mhm.
but you like a little bit of that mature look. Now let's see if we can combine the two
Okay.
and see if we can't get something even better than both of these, okay?
Okay. Do you think we could go a couple millimeters lower? Would that be possible? On the front? Or just take the whole thing down a couple millimeters?
Let's take a look. You can try it.
Up to you.
Yeah. Let me try something, and we'll just kind of keep bouncing back and forth
Okay.
and see what looks the best for you, okay?
Sure. And then the single grafts, are they going to go below this line?
They're going to
Or-
go on and below.
On and below, so it'll
you-
be a
it
little
looks
bit.
like you have just enough for the hairline, which is the best case scenario.
Okay.
So the hairline, we always want it to be single hairs.
Yeah.
We don't want multiples on the hairline. That's what makes it look fake, pluggy.
Yeah. So when you do the dots,
Mhm.
the dots would go below this line, and
Mhm.
okay.
So on the line that you just saw, the brown line,
Mm.
which will eventually be blue,
Mm.
that's going to be all the singles. And then in front of it, with those irregularly placed dots, those are also going to be singles. Yes. That's what's
Yeah.
going to give it that natural soft look.
Yeah. What I'm thinking, just
Mm-hmm.
gut instinct, is this side, but just a couple millimeters lower,
Mm-hmm.
and I would like to see what that looks like. But
Okay.
you do what you're doing.
Let's take a look. Thoughts? Evaluate just the right side now. I dropped it by about 2 millimeters.
I can see.
You can see how this line was originally higher than the line here.
I was lining it up with my mole.
Yeah.
I was like, I know you dropped it 2 centimeters. That looks awesome.
You like the right side a lot?
Yeah. It's
Yeah.
looking pretty good.
I love that right side now.
Looking good.
Yeah. So
Yeah.
what I want to do now is I want to match your left side more or less with your right side.
Yeah.
But I still want it to be a little bit different. Because I want to take one more look at the differences between the left and right, see if we can't come up with anything better.
Sure.
It's going to be a little tough because now I'm really liking this right side.
Sure.
But I want to make a few changes now on your left, okay?
Okay. Yep.
Beautiful. Turn towards me, chin down. Do you see any appreciable difference between the left and the right?
Mm-hmm. It's so close.
Yeah.
Which is good. That's what I want it to be.
Yeah.
I understand the term, sisters not twins,
Mm-hmm.
but It's looking pretty good. I'm liking it.
Yeah.
I'm thinking maybe this side is a little too far back.
Yep, that's literally the difference.
Yeah,
That's
okay.
the only difference.
Yeah.
So I'm glad you're able to spot that.
Yeah.
So, like I said, I still want it to be a little bit different. This being a little further back is more so a product of trying to adjust it and keep it similar, but not the same.
Mm-hmm.
Now, what I'm going to do is match this angle to look a little bit more like this one now.
Mm-hmm.
And it's not going to even take much in terms of changing the structure of the design. I'm just going to clean up part of the top,
Mm-hmm.
and that's it. And you're going to see a big difference once that's cleaned off.
Yeah.
So Jesse, congratulations, you're officially halfway done with the day.
Mm-hmm.
What we're going to do now are the injections in the eyebrows. So this is typically the most sensitive part of the day, but it's very quick.
Cool.
Now, I'm going to explain to you how I do it, so you're fully prepared with what to anticipate. I'm going to count to 3. 1, 2, 3. I'm going to inject immediately after 3. I am in and out in less than a second. But the most important thing for you, don't move your head. Don't squeeze your eyes shut. Don't manipulate the eyebrows up and down, because that's going to take the needle up and down with it.
Yeah.
And I don't want it to redirect into the eye. It's never happened. I don't ever want it to happen, which is why I'm being so clear with exactly what I'm going to do and how I'm going to do it. 1, 2, 3, 4. 5-second timeout. 1, 2, 3, 4 again. So for a total of 8 injections. Second round is not nearly as uncomfortable as the first, but it does still pinch a little bit, okay?
Okay.
Ready to get started?
As ready as I can be.
1, 2, 3. 1, 2, 3. That's the first set on the left. We're going to move on to the right. 1, 2. 1, 2, 3. Beautiful.
Oh, you got me.
I'm sorry. I know that sucks. But almost immediately it'll start going numb. 1, 2, 3. Perfect. How was that second round for you?
I didn't even flinch.
You didn't. You did a great job.
I'm just kidding. I flinched a lot. That was really, really eye-watering.
Yeah.
It wasn't as bad as you built it up to be, but it was eye-watering.
What we're going to do now are the injections that I had mentioned earlier for you, okay?
Mm-hmm.
So starting right here in the middle, working my way out. Middle, you won't feel it too much, but as I work my way to the corners, again, it's going to be a bit uncomfortable just until everything is fully blocked, okay?
Mm-hmm.
Ready?
Mm-hmm.
Little vibration device to help distract your nerves.
Mm-hmm.
1, 2. I'm sorry. I know it doesn't feel good, but you're almost there. Most uncomfortable area right here. Perfect. Working on the left now.
Mm-hmm.
1, 2, 3. Doing great. I'm sorry. I'm sorry. Perfect. We're going to get started.
Mm-hmm.
The right side hairline, just like it's been important all day, you do not move your head, okay? If you need to, you let me know first, and then you still don't move your head until I give you the heads up that you're ready to go. Sounds good?
Yep.
Following the angles for you.
I was very nervous. I'm kind of a hypochondriac, so I don't do stuff like this. But this is very important to me to do, and so I kind of only had one option. After I did my research, I was like, well, this is the only place I'm going to go. And so we got it done, and it's just, I'm completely blown away by how professional everybody's been. Everybody's just, you couldn't ask for a more top-notch facility and people to work with, and they really nailed it. It's really, they've made everything really easy.
We're almost done with the hardest part of the incisions. We'll be done maybe in about 15 minutes with the entirety of the third phase.
Okay.
That's when we're going to draw your blood for the PRP and get you your lunch.
All right, sounds good. I ordered filet mignon. I'm excited to see how it is.
Very good.
Good.
Opportunity. Did you want to see what it looks like before they start
That'd be
implanting?
awesome. Yeah, I would love to.
Perfect. So Alexis will hand you a mirror.
Thank you, Alexis.
Let's take a look. I know it's a little bit bloody.
This is insane. This is so
You
wild.
already see the structure of your face is going to look completely different.
It really, yeah. It's going to totally change on my face.
And whatever you're seeing now is still higher up than what the final product will be because of all those
Little puffy.
injections. Yep.
Yeah.
So it's going to drop a little bit. It's going to get more condensed. And it's going to get even more dense.
Yeah.
Now this is your PRP stem cells. There's 5 of these syringes. This for you today. What we're going to do is we're going to expedite the healing process, and the most important thing for today is that we want to improve the survival rate.
Yeah.
We had talked prior to you even booking the procedure.
Mm-hmm.
I talked to you about the risks and the benefits because you've referenced your ridiculous hairline
Mm-hmm.
multiple times today, but
Mm-hmm.
it's not from hair loss. That was
Yeah.
your natural hairline.
Yeah, unfortunately. I
It
brought
was-
baby pictures to prove it.
Yeah.
I was born with a crazy wild hairline.
Yeah.
It runs in the family.
I almost never believe people when they say that, but I believe you because you showed me the receipts. So, the most important thing to know is that if an area doesn't have hair,
Yeah,
it's not designed to grow hair
correct.
because it never had hair. So, what we did is we went into a large area that never had hair. So,
Yeah.
the survival rate can be lower,
Mm-hmm.
which is what we had talked about during our consultation.
Correct.
And what can we do to help bring the survival rate back up? PRP with the exosomes that are in here. What that's going to do is it's going to lay a favorable environment, a foundation for the grafts that we're going to implant.
Mm-hmm.
When we take them from here in the donor, we're removing them from the blood supply, the muscles, the glands, everything that keeps it healthy.
Yeah.
And when we implant it here, it doesn't have any of those things on its own. So it has to develop all of that. And platelets are the cells in the body designed to heal trauma to the skin. So when I concentrate them and I inject them into the areas we're working on, because they're designed to heal that trauma, you're going to heal faster.
Mm-hmm.
So that foundation will allow for the survival rate to increase. I've seen a survival rate that should be 50 to 60%, boost up to 99% because of this combination here. So I'm very excited to see what you're going to look like in 6 months, Jesse.
Yeah.
I think everything that we did for you today is going to come out quite nicely for you, okay?
Yeah, I agree.
I'm going to do these injections now. The stem cells can also improve some of the natural non-transplanted hairs in the areas too.
Mm-hmm.
So that's what we're going to hope to see. That'll just be a cherry on top down the line, okay?
Sure.
You shouldn't feel any of this, but in the event that you do, you let me know, okay?
Okay.
1, 2.
I haven't even felt one poke this whole time. I was trying not to say that to not jinx it, but I don't feel a single thing.
Good. Team, what we're going to do now, 3 to 4 rows of singles for the hairline. Use the highest quality singles, please. Up to the front of the blue line, we're going to do triples. Once that area is complete, we'll work on the blue line, working inside out for the triples, okay? Everything behind it in zone 1 up until the second blue line you see will be doubles. This area right here, we can put the additional singles that remain. There should only be about 40 or so singles left. All of this otherwise will be doubles and maybe a couple of singles. Okay? Good. Clear? Switch the singles here. Doubles practically behind this line. Everything else will be triples in the front. Okay? Now, Jesse,
Mm-hmm.
the most important thing for you moving forward is don't move your head.
You got it.
Intermittently, I'm going to come in. I'm going to make sure you're comfortable. I'm going to make sure everything's going smoothly for the team. Okay?
Perfect.
Instinctively, when I talk to you, you're going to want to nod your head. Don't do that.
You got it.
Every time I walk in, I'm going to say the same thing. Jesse, don't move your head. And then I'm either going to ask you a question or I'm going to talk to the team.
Okay.
Verbally respond, give me a thumbs up. All of that is okay. Just don't nod your head or move.
Okay.
If you do need to move your head, again, let them know so nothing is traumatized.
And you can give them permission if I move to give me a good smack, okay?
Sounds good. As long as it doesn't knock the grafts out.
Okay.
If you have your phone on you, use it if you want to. If you have the TV remote, just if you're going to use your phone, take it, bring it to your line of sight.
Yeah, you got it.
Don't instinctively look down at it, moving your head.
Okay. May I ask how long this is anticipated to last?
I'm going to predict It could be 2.5, 3 hours. It could be 4.5, 5 hours.
Okay.
It depends on how readily your body accepts the grafts.
Okay.
You did bleed a little bit above average during the incisions phase, and the more you bleed, that's a little bit of pressure underneath. So when we implant a graft and you bleed, it may slip back out a little bit.
Okay.
So that can extend the time. Now, it doesn't compromise results in any capacity. But that being said, you may just be here for a little bit longer than what we had discussed in the morning. I had predicted between 4 and 5. That's probably going to be closer to at least 6 now.
Okay. Well, there's nowhere more important that I could be than right here. So please take your time.
So no going to the bar tonight. You're going to be here
Nope.
hanging out with us, okay?
I'm ready for it. And I would like to say that, for the camera, every single person I've met here has gone so above, the staff has gone so far above and beyond in their professionalism and how nice they were. I just really want to highlight that everybody here has just been over the top.
Go through a few quick things for you. It's nothing super intense, but just things to kind of bear in mind, especially as you're going to change in just a moment. Like you mentioned just a few moments ago, head up of heart, chin parallel to the ground.
Mm-hmm.
Your grafts are extremely loose.
Mm-hmm.
So if you were to bend over, gravity's going to pull them out.
Okay.
So if you're going to pick something up off the ground or you're going to put your shoes on, you squat to pick it up. You don't bend over.
Okay.
You're going to get dressed, you sit, you lift your leg, and you put on underwear, pants, socks, shoes like that.
Okay.
If you bend over, your gut pushes in, gravity assists, and your heart is pumping. With the assistance of gravity, the grafts can pop out. So, most common places that people hit their heads: getting in and out of the car,
Oh yeah.
cabinets, trunk of the car, shower doors and curtains, going under the desk to reset a modem, things like that. Be very careful of your surroundings. Your head is numb, it's shaved, it's swollen. So be very cognizant with every movement you make. Grab the roof of the car, duck down, watch yourself get it. Open the cabinet, take what you need out, close it. Don't fumble around under a open cabinet door, lift your head and crack it open. It's happened here.
Yeah.
Please be careful.
We'll do.
Okay? Beautiful. Only zip-ups or button-downs for the next 28 days.
Okay.
Nothing that you pull over your head so you don't inadvertently wipe any of the grafts out.
Okay.
Now in just a moment, once Ian is done putting the bandage on for you,
Mm-hmm.
I'm going to hand you the mirror. You're going to take a look at the grafts for the first time. Implanted, everything looks fantastic.
Okay.
How
How swollen is my head?
It's not super apparent now because it's all in the grafted area,
Mm-hmm.
but you're going to notice it more over the next 2 days or so.
Understood.
And over the course of a week, it'll go away pretty quickly. But once the bandage is on, I'll show you the paper surgical cap that you're going to wear just for tonight, just until you get to the hotel. The cap is paper and your grafts are wet, and if something is wet and touches paper and dries, it's going to stick to the cap. And then when you take the cap off, it'll take grafts with it, which is why I'm going to show you how to put it on, show you how to take it off, and I'd like for you to take it off as soon as you get to the hotel.
And then leave it to breathe overnight.
Correct.
Okay.
Yeah, the bandage stays on, but the cap comes off when you
Understood.
get to the hotel. And then you'll just put it back on just to come here in the morning. And then when you leave here tomorrow, you'll leave wearing a much nicer cap that you can wear for extended periods of time. But just the one that you're going to leave here wearing today is the one that's going to come off as soon as possible and stay off all night tonight. Ready?
Yeah.
Here you go.
Unbelievable. That is insane.
Yeah.
That's gonna look so good when it grows out.
Yeah.
Yeah.
And
Jeez.
for all intents and purposes, almost the entirety, about 85% of your zone 1,
Mm-hmm.
all triples. And like I mentioned in the morning, those triples are like 4s, 5s, 6s. So
Yeah.
it's going to be really dense.
This is
It's gonna be
nuts.
really dense.
This is wild.
Yeah. What do you
It's
think?
like-
Like it?
I love it.
There you
I
go.
love it. Been waiting to see this my whole life.
Congratulations, my
Yeah,
friend.
thank you. Thank you.
Jesse's back today. We're going to do his day 1 wash. How'd you sleep last night?
Pretty good. No complaints. You had to get used to sitting up and sleeping, but I have zero pain, so
Good.
that was good.
Very good.
I was not expecting that.
I'm going to get you situated. Then what we're going to do, Jesse, is we're going to walk through
Mhm.
exactly what it is that you're going to be doing for the next, week, 2 weeks, 4 weeks.
Great.
We'll go through the instructions, how you're going to wash the grafts, and if there's any questions that you have, feel free to stop me at any time. My goal is to make sure that you fully understand everything that it is that you're going to have to do over the course of the next 4 weeks or so.
Perfect.
The first 7 to 10 days or so are usually the most involved. After that, you'll just have a few things to do just in the morning and then just in the evening. Whenever we're wiping the donor area, take note of the amount of pressure that I use.
Okay.
That pressure is going to allow for more blood flow to come to that area so you heal faster.
Mm-hmm.
Right now you have open wounds in the back of your head.
Mm-hmm.
But what else is back there? All these hairs that we didn't touch. And right now they're really short. They're like this. And short hair is very rigid.
Mm-hmm.
Long hair flows a little bit better. It's softer. And over the course of the next couple of days, that hair is still going to grow. And when we clip the hair, the tip is very sharp.
Mm-hmm.
So if it's like this now, in a few days it's going to grow like this. And then when you lean your head back on a pillow, that sharp, rigid hair may dig into that area where we extracted the grafts from, and that feels like the injections for the donor.
Mm-hmm.
But if we stimulate the area enough to heal now, you shouldn't worry about that discomfort in about a week's time. Okay? So short-term discomfort for long-term improvement is what our goal is. It may still happen. You may still have some discomfort in a week's time whenever you're manipulating the area or trying to sleep. It's all completely normal, okay?
Good.
So, what I'm going to do now is I'm going to walk you through the 3 steps to wash the areas. After I walk you through those 3 steps, I'm going to do all 3 of them. And I'm going to show you, I'm going to hand you a mirror so you see exactly what it is I'm doing, how it is that I'm doing it.
Okay.
And then at the end, you have any questions, you let me know.
Will do.
Sounds good?
Yep.
So there's 3 parts to this wash. You're going to wash the grafted area. You're going to then rinse the grafted area. And then you're going to wipe the donor area.
Good.
So wash, rinse, wipe. You're going to have 2 bottles. I'm going to show them to you now. More or less this size. I don't want them to be too small.
Mm-hmm.
I want them to be around 8 to 12 ounces. I don't want them to be much bigger.
Mm-hmm.
It is a wet process. This is rigid. I don't want you to accidentally bump your head.
Understood.
One of them, I'd like for you to label as shampoo.
Mm-hmm.
The other one, I'd like for you to label as clean water. The one that you're labeling as shampoo, fill it halfway with clean drinking water.
Mm-hmm.
Bottled water is perfect. Filtered water is fine. But do not use distilled water. Definitely not.
Well,
Okay?
I will not.
So halfway with clean drinking water, this is the shampoo that we've provided for you.
Mm-hmm.
You will use 1 teaspoon up to a tablespoon and put it into that half bottle of water. Then fill it up the rest of the way with more water and give it a little mix like this.
Mm-hmm.
The second bottle, label it as clean water. That's it. Fill it all the way to the top. The first thing I want you to do before every wash is check the caliber of spray. We want to see a mist.
Mm-hmm.
We do not want to see
Stream.
a jet stream.
Yeah.
That will dislodge the grafts.
Good.
So before every wash, make sure it's misting so we don't traumatize anything. So the 3 parts, once again, wash, rinse, wipe.
Mm-hmm.
Holding it with 2 hands, about an inch or so away, you're going to spray the area down. I do still want you to spray down the crown and the donor area a bit, but the majority of that half a bottle that you're going to use
Mm-hmm.
will be for the actual grafts themselves.
Okay.
You'll use half for your morning wash, the other half for your evening wash. Okay? So you're going to make 1 of these mixtures per day. After you've used that half bottle to wash everything, take the clean water bottle and spray it down again. As long as all the bubbles are off, it doesn't really matter how much of this that you use.
Mm-hmm.
But since you're using half of this, to maintain that congruency, a lot of my clients prefer to use half of this as well, just so we remember it. And then finally, you're going to wipe the donor area.
Mm-hmm.
Wiping the donor area is the uncomfortable part. Bear with it, it goes away very quickly. It will be helpful for you to have maybe a cup or a bowl filled with clean drinking water and put maybe 3 or 4 pieces of gauze in there, so that by the time you're done with the wash and the rinse, the gauze has sufficiently absorbed the water, you can fold it up and wipe the donor area down.
When I wipe it, it's just with clean water?
Clean water.
You got it.
You'll spray it a little bit with a shampoo mix, and I'm going to show that to you as well.
Sure.
But the majority of the shampoo mix will be for the grafted area.
Mm-hmm.
And then eventually when you get to the wipe, you'll fold it into quarter pieces. This is the woven gauze. Fold it into quarter pieces as it's soaking wet and wipe the donor area clean.
Yep.
Okay?
Yep.
Do not wipe the grafts out, please.
Understood. Yeah.
All right, so I'm going to get you in position. We're going to start with the wash now, okay?
Okay.
2. Now, as you can see, I'm not really holding back with the pressure.
Yeah.
Now, I'm going to use more than half the bottle, but this is just because it's your first wash. I want to get it as clean as possible. The first night is when your scalp's going to leak a little bit of plasma, a little bit of blood the most.
Yep.
And as you can see, whatever I'm spraying in the front is working its way down the back.
Mm-hmm.
So it's going to start the process of moisturizing the donor, start the process of cleaning the crown as well. But I do still want you to spray the donor a bit. So as I'm spraying it, you see that fine layer of whitish gray bubbles that forms?
Mm-hmm.
That's what you want to see. So that's the first part, the wash. What's next is the rinse. Now I'm going to show you really how much it takes to rinse everything off.
Okay.
1, 2. All the bubbles are off.
Okay.
You're practically done with this part.
So no, it doesn't take time.
It doesn't take much at all.
Now we need to wipe.
Now we're going to wipe. So I'm going to put this bottle down, and bear with me. I'm going to sit you up now, okay?
Okay.
Do me. Beautiful. You'll take a piece of gauze
Mm-hmm. Hold it.
and fold it in half once, and once again into quarters. Starting on one side of the donor, you're going to work your way around. And the way that I want you to do it is take that piece of gauze, start at the top, and wipe top to bottom only. You're not going up and down circles, scrubbing it, nothing like that. Just top to bottom. Your goal is to get all this antibiotic ointment off. And if there's any little bits of scabbing, we want you to get that off too. Don't force the scabs off. They'll come off. If they don't come off now, they might come off tonight or tomorrow morning.
Okay.
But the goal is to get as much of that off as possible. We're going to start on the top, top down,
Good.
lift, rotate, and move our way across the donor. Once we've worked all 4 sides of the gauze, we'll flip it to the clean side and continue to work our way around.
So you're talking every 8 passes, you're gonna get a new piece, basically.
Correct.
Okay.
And again, that's just how I do it. You can use one pass, throw it away, grab a new piece. However you feel the most comfortable doing it. Okay? Now, instinctively, you're going to want to pull away from the discomfort. I want you to push into it. 3. 1. Rotate, move. 2. Rotate, move. 3. Rotate, move. 4. Lift it. Flip it to the clean side. Top to bottom. Rotate and move. Top to bottom. Rotate and move. Top to bottom. Rotate and move. And top to bottom. Rotate and move. As you can see, that worked its way all the way around your donor. But we're going to do another one now.
Okay.
I want at least 2 passes. And if you see any areas that there's still a little bit of donor antibiotic cream that's caked on, just put a little bit of extra attention to that area. So now that I'm here, we're going to work our way back around left to right. Ready?
Good.
1, 2, 3. 1. Rotate, move. 2. Rotate, move. 3. Rotate, move. 4. Flip it to the clean side. And 1, 2, 3, and 4. Beautiful. All right.
Yeah, not as painful as I thought. It didn't feel good, but
Right.
it wasn't. It's not that bad.
It's not too uncomfortable, but you know, everyone's pain sensitivity is different. But all in all, not terrible, right?
Yep. That's way different.
Yeah. You see how quickly this area heals.
Yeah.
There were 3,200 tiny little pokes back here. The vast majority of them, especially on the back here, you see how different they look. They look like they're already 75% done healing.
Yeah.
So the donor heals very quickly. The first 50% or so, plus or minus, of course, is typically over the course of the first night,
Mm-hmm.
and the other 50% does take up to like 5 to 7 days total. But every day, of course, is going to be a little bit better than the last.
Okay. We just wrapped everything up. I'm very happy with my results. I FaceTimed a bunch of people, and they're like, they just can't believe the hair on my head. This whole process has just been so easy, just so unbelievably easy. Now that I've done it at the LA FUE Hair Transplant Clinic, I would never even consider going somewhere else. They just made it so easy. The staff was so friendly. They were prepped. This is a very well-oiled machine. When I walked in, everybody had my name on the whiteboard. Hi, Jesse, right when I walked in. Everything's been really great. So I'm beyond impressed. The pain was minimal, if anything. And I was expecting to wake up the next morning and have, a ton of pain when the numbing wore off. But it's zero pain whatsoever, and I feel great.